Are you hypermobile and wondering if you qualify for a Hypermobile Ehlers-Danlos Syndrome diagnosis? In this video, we're going to sit down together and go step by step through how Hypermobile Ehlers-Danlos Syndrome, or hEDS for short, is diagnosed, and how you can be confident whether or not you likely fit this diagnosis. We'll accomplish this together, all from the comfort of your own home. Before watching this video, we recommend watching our previous video, HSD/hEDS, Am I Hypermobile or Just Flexible? Find out now. In that video, we teach you how to screen yourself for systemic hypermobility. After you've determined that you meet that criteria, whether through the Beighton Score or the 5-part questionnaire, return to this video and we'll go over together whether or not you qualify specifically for hEDS. As an overview, we're going to break down the diagnostic criteria for Hypermobile Ehlers-Danlos Syndrome so you have a better understanding of what to expect when working with healthcare providers. Now, first off, this video is for educational purposes only. We always recommend getting a formal workup with a qualified healthcare practitioner. Second, this video is being produced towards the end of 2024, and it's based on the 2017 diagnostic criteria for Hypermobile Ehlers-Danlos Syndrome released by the International Consortium on Ehlers-Danlos Syndromes and Related Disorders. This is the gold standard in the diagnosis of hEDS currently. Constant updates to the diagnostic criteria may occur, and there's some exciting research being completed to identify genetic markers specifically for hEDS. Right now, however, hEDS is diagnosed through a formal clinical workup, history, and exclusion of other disorders. When a change in the diagnostic criteria happens, we will create a new video to reflect this, so be sure to check out other videos on our channel. This will be a comprehensive and in-depth video of the diagnostic criteria. This is definitely geared more towards the kind of person who likes to learn and understand things on a deep level. So if that's you, you are in the right place. Regardless, you cannot be diagnosed from a video alone, so please be certain to follow up this video with a qualified medical professional in your local area. For your convenience, we've included a direct link in the description below to a PDF of this diagnostic criteria provided by the Ehlers-Danlos Society. We highly recommend printing out that criteria and having it with you during this video, or pulling it up on your screen to go along point by point to see where you stand in your own body. You can also find the written summary of our notes from this video in the description below. Now let's start with a broad overview of the hEDS diagnostic criteria, and then we'll go into more detail of each point. Diagnosing hEDS requires looking at 3 main criteria. You must meet all 3 criteria simultaneously for an official diagnosis. Here's how each criterion contributes to the overall assessment. Criterion I is looking at generalized joint hypermobility. This criterion assesses the overall flexibility of your joints. It uses a specific scoring system called the Beighton Score, which measures how flexible certain joints are. We discussed this in our previous video, Am I Just Flexible or Hypermobile, in more detail, which can be found by clicking the link in the top right corner of this screen. Now, Criterion I evaluates how well you can bend and extend certain joints like your fingers, thumbs, elbows, knees, and back. It's adjusted based on your age to account for the natural decrease in flexibility as you get older. Why this matters? People with hEDS often have joints that bend beyond the normal range, making this the foundational part of the diagnostic process. As we pointed out in our previous video, the Beighton Score is not without fault, which is why the 2017 criteria for hEDS includes the 5-part questionnaire, or 5PQ, as part of the criteria as well. This takes into consideration changes as we get older, arthritis, or surgeries. Now, Criterion II is looking at specific physical features and symptoms. This criterion dives deeper into the other physical features and symptoms that often accompany hEDS. It's divided into 3 features, A, B, and C. Feature A looks at various physical signs like unusually soft skin, stretchy skin, and other traits seen in hEDS. Feature B considers family history, seeing if you have a close relative with a confirmed hEDS diagnosis. And feature C focuses on chronic symptoms like pain, joint dislocations, and instability. Why this matters? While joint hypermobility alone isn't enough to diagnose HEDS, these additional features help confirm it, distinguishing HEDS from more general hypermobility conditions. And lastly, Criterion III looks at the exclusion of other conditions. The third criterion is about ruling out other possible diagnoses. It ensures that your symptoms are not caused by other connective tissue disorders like Marfan syndrome or lupus, or other conditions that can also cause joint hypermobility. It also confirms that you don't have fragile skin, which would suggest another type of Ehlers-Danlos syndrome. Why this criterion matters? This criterion is important to make sure the diagnosis is accurate and specific to HEDS, as other conditions can have overlapping symptoms. Putting it all together. To diagnose HEDS, you have to pass all three of these criteria at the same time. So you must have generalized joint hypermobility, which is Criterion I. You must have 2 or more specific features, A, B, and/or C, under Criterion II related to HEDS. And to clarify, within feature A alone, 5 characteristics must be present. Feature B is self-explanatory, there's only one question here, and feature C must have at least one of the 3 choices positive. And then lastly, you must rule out other conditions that could cause similar symptoms, which is Criterion III. Now, this scoring system will make a lot more sense if you have the PDF printed up on your screen as you go along with this video. This step-by-step process ensures that the diagnosis of HEDS is precise and backed by both physical signs and a thorough medical evaluation. If you meet these criteria, you have HEDS. If only Criterion I is met, you may instead have hypermobile spectrum disorder, which is a related but less complex condition. HSD versus HEDS. HSD is less severe and generally involves fewer systemic complications than HEDS, focusing primarily on symptoms related to joint hypermobility, such as pain, instability, or soft tissue injuries. HEDS, on the other hand, requires the presence of both generalized joint hypermobility and additional clinical features that indicate systemic involvement, as outlined in Criterion II and III. Real quick, if you're finding value in this video, please like the video and subscribe. If you enjoy this video, we also strongly believe you will like what we're doing over at HypermobiliPT.com, where we're building a private community for those navigating their journeys through HSD and HEDS. Visit HypermobiliPT.com for more details. Now let's dive deeper into the specifics of each criterion, so make sure you have your worksheet handy. Criterion I is establishing joint hypermobility. As mentioned above, we give greater details on how to complete this testing on your own in our other video, Am I Just Flexible or Hypermobile? I'll link that again in the top right corner of your screen. We recommend watching that first if you haven't already. To meet Criterion I, you must have a certain level of joint flexibility, which is measured using the Beighton Score, a 9-point scoring system that assesses hypermobility based on 5 joint tests. Here's how to understand this criterion. The Beighton Score ranges from 0 to 9, with 1 point awarded for each side of the body that meets the criteria in certain tests. The tests include placing your hands flat on the floor without bending your knees, 1 point, bending the thumb to touch the forearm, 1 point for each thumb that qualifies, 2 points total, bending the finger back beyond 90 degrees, 1 point for each pinky that qualifies, 2 points total, straightening the elbow beyond 10 degrees, 1 point for each elbow that qualifies, 2 points total, straightening the knee beyond 10 degrees, 1 point for each knee, 2 points total. Depending on your age and sex, the minimum required score varies. So for children, those before puberty, and adolescents under 18, you need a score of 6 out of 9 or more. For adults up to the age 50, you need a score of 5 or more. Adults age 50 or more, you need a score of 4 or more. If your Beighton Score is just 1 point below the age and sex-specific cutoff, you can still meet Criterion I if 2 or more of the following historical factors are present. Placing your hands flat on the floor without bending your knees, past or present. If you can currently, or you could in the past, reach the floor with your palms while keeping your legs straight, this counts as a supporting factor. Thumb touching to your forearm, past or present. If you can currently or could in the past bend your thumb to touch the inner part of your forearm, it's another supporting sign. As a child, did you amuse your friends by contorting your body or doing the splits? If you have a history of being able to bend your body into unusual shapes or do the full splits during childhood or adolescence, this is relevant. Shoulder or kneecap dislocations on more than one occasion as a child or teenager. Repeated dislocation of major joints like the shoulders or kneecaps before adulthood is another sign of generalized joint hypermobility. Lastly, considering yourself double jointed. If you describe yourself as being exceptionally flexible or double jointed, this counts towards the historical factors. Meeting Criterion I requires either achieving the required Beighton score based on the age and sex, or reaching the slightly lower score with the 2 or more additional historical factors described above. Now, moving on to Criterion II, features A, B, and C. You need to have at least 2 of the following features, A, B, and C. Feature A. Underneath that, you need to have at least 5 of these signs. Let's go through these one by one. Unusually soft or velvety skin. The skin should have a texture that feels softer or smoother than average, described as having a velvety feel. It might be best compared to the texture of fine fabric or suede. This softness is different from simply well moisturized skin and is typically present across most of the body. Mild skin hyperextensibility. Skin hyperextensibility means the skin can stretch further than normal when gently pulled back. A practical way to measure this is to pinch the skin on your forearm, back of the hand, or the neck. For a positive sign, the skin should stretch more than 1 to 1.5 centimeters or 0.4 to 0.6 inches. The stretch should also recoil back when released. Truly hyperextensible skin may take longer to return to its original shape. This testing should be done when the skin is relaxed, not taut, and without excessive force to avoid injury. Next point, unexplained stretch marks. These stretch marks typically appear as red, purple, or white lines on the back, groin, thighs, breast, or abdomen. They occur even without a history of significant weight gain or loss, or puberty-related growth spurts, or pregnancy. The marks are often wide and may occur spontaneously, so take a moment to check yourself out now. Next point, bilateral piezogenic papules of the heel. These are small, soft lumps that appear on both sides of the heel when standing. They're caused by fat tissue bulging through connective tissue layers due to increased pressure when weight bearing. They usually resolve when weight bearing is taken off of the heels. Recurrent or multiple abdominal hernias. Hernias, which are bulges caused by tissue pushing through weak spots in muscles, can occur in different areas. There can be umbilical or inguinal, for example. Multiple or recurring hernias are characteristic even without significant physical strain or other typical causes. Next, we have atrophic scarring at 2 or more sites. Atrophic scars are thin, depressed scars that occur after skin injuries. They are different from the thin, papery scars that are typically seen in different types of EDS. These scars are wider or sunken, but should be present at 2 or more sites on the body to meet this criterion. Next, we have pelvic floor rectal or uterine prolapse. This characteristic includes the prolapse of organs in the pelvic region, such as the bladder, rectum, or uterus in individuals who haven't experienced childbirth or obesity. The prolapse can be identified through physical examination and often results in sensations of heaviness or discomfort in the pelvic area. So even if you haven't had a thorough evaluation of that yet, those kind of heaviness sensations or sometimes changes in bowel or bladder can also be a hint that you should have this checked out further. Dental crowding and high or narrow palate. The teeth may be crowded, causing issues with alignment, and the palate, the roof of the mouth, may be unusually high or narrow. This is often noted by dentists or orthodontists during routine examinations. So a lot of times a dentist will have told you this by now. You can also look up pictures of what this looks like online. Arachnodactyly. This refers to having long, slender fingers that resemble spider legs. It's assessed using 2 signs. The wrist sign, also known as the walker sign. The thumb and fifth finger can overlap when wrapped around the opposite wrist. Then the thumb sign, which is also known as the Steinberg sign. The thumb extends beyond the edge of the palm when making a fist. Both signs must be present on both sides. Next, we have an arm span to height ratio of greater than or equal to 1.05. So you have to have some help with this one by someone around you. This measurement is taken by comparing the distance from fingertip to fingertip, your arm span, compared to your height. If the arm span is at least 5% greater than your height, it is considered significant. Next, we have mitral valve prolapse. MVP is a condition where one of the heart's valves does not close properly. It can only be identified through an echocardiogram, which should show at least mild prolapse to meet this criterion. Next, we have aortic root dilatation with a Z-score of greater than or equal to +2. This means that the aortic root, the part of the aorta closest to the heart, is wider than normal, as measured by an echocardiogram. The Z-score, which compares the aortic measurement to normal values adjusted for body size, must be greater than +2. You'll notice that those last two in particular are ones that you can't measure on your own and requires a physical examination and an echocardiogram. However, a lot of times we find that most of our patients meet enough of these criteria from feature A before even getting that information, but we still recommend that you have it done if your healthcare provider thinks it's relevant. So that's everything in feature A. Now we're on to feature B, still under Criterion II. And this one's pretty straightforward. A positive family history. This means having at least one first-degree relative, a parent, sibling, or child, who has been formally diagnosed with HEDS according to these criteria. Lastly, we have feature C. You must have at least one of the following signs: musculoskeletal pain in 2 or more limbs recurring daily for at least 3 months. This refers to joint or muscle pain in at least 2 limbs, arms or legs, lasting at least 3 months and recurring on a daily basis. Lastly, we have chronic, widespread pain for 3 months or more. This includes persistent pain affecting various parts, lasting for 3 or more months. Recurrent joint dislocations or instability. Joints may dislocate where they're coming fully out of place, or sublux, partially slipping out of place repeatedly. This happens without trauma and involves at least 2 different joints, confirming instability. Lastly, we have Criterion III. All of these prerequisites must be met. Absence of unusual skin fragility. If the skin tears easily or shows extreme fragility, this may indicate another form of Ehlers-Danlos syndrome, such as classical or vascular types, and HEDS should be reconsidered. Exclusion of other connective tissue disorders. Conditions like Marfan syndrome, Louis-Dietz syndrome, or osteogenesis imperfecta must be ruled out through physical exams, history, and sometimes genetic testing. If a person has a coexisting connective tissue disorder like lupus, they must still meet features A and B, but not C, of Criterion II to be diagnosed with HEDS. Exclusion of alternative diagnoses that include joint hypermobility. Other conditions that cause loose joints, like neuromuscular disorders or skeletal dysplasias, should be ruled out before diagnosing HEDS. This may require molecular genetic testing and a thorough history review. How to score the criteria together. To receive a diagnosis of Hypermobile Ehlers-Danlos Syndrome, or HEDS, you must pass Criterion I by achieving the appropriate Beighton Score or using historical hypermobility factors. You must pass Criterion II by meeting at least 2 features, A, B, or C. You must pass Criterion III by confirming the absence of other conditions and unusual skin fragility. If all 3 criteria are met together, the diagnosis of HEDS is confirmed. If only Criterion I is met and Criterion II and III are not fulfilled, the diagnosis suggests hypermobile spectrum disorder, HSD, instead, unless a viable alternative in Criterion III is discovered by your provider. Now, what do we do with this information? What is the next step? Well, as you saw, Criterion III requires a medical professional to rule out other systemic causes such as lupus and Marfan syndrome. But taking in this mostly completed diagnostic criteria to a healthcare provider can give you a head start. So you might wonder, how do you find a doctor who is skilled in diagnosing HEDS? That's what we're going to cover in the next video. So be sure to subscribe, watch our previous video in the top right corner. And if you like this video, we strongly believe you will love what we're doing over at HypermobiliPT.com, where we're building a private community for those navigating their journeys through HSD and HEDS. Visit HypermobiliPT.com for more details.